This exercise is called a SNAG, or a mobilization with movement, to help improve your neck range of motion or mobility. So what we're going to use today is a pillowcase, and all I did was fold it in the length way in fours, so it looks like this. Then what you're going to do is you're going to wrap it just on the back side of your neck and just secure it properly. So it looks just like this. So what you're going to do is you're going to cross your hand position. So the right hand is going to grab the left portion of the towel, and the left hand will grab the right portion of the towel. So this setup with your right hand across is going to be pulling towards the right. So it's going to be helping you with left rotation. So what you do, with the bottom hand, it's important that you just secure it down by your chest and don't pull it across. You just want to secure it there, and then you're going to pull up and across as you turn your head to the left, just like this. I tend to like to go up and across because that is more in line with the plane of the joints in the neck and how they move. So what you want to do is, as you're mobilizing this or doing this exercise, you want to listen to your body. You don't want to be too aggressive where you're cranking on the neck and it's causing you a lot of discomfort. If you need this exercise, it's because you have a limitation of motion. So you have to listen to your body, and it'll let you know where the end point is as far as your motion. You don't really want to hit the rev limiter as you rotate and mobilize, because you may experience some soreness after. So it's best to repeat this exercise. However, I recommend starting at a low dosage, maybe 5-10 repetitions, and see how you tolerate it. And don't be cranking too hard because you don't want to cause too much aggravation. You're trying to see how your body responds to this exercise. But in the end, if you're responding well and everything's doing okay, you can start to increase the amount of repetitions. There is no set. I'd say the maximum, no more than 1 to 5 minutes, depending on your tolerance. This is a great way to help improve the neck range of motion and mobility of your neck.